Hello and welcome. You're watching Voice News Network. My name is Pragya Diwan, and today I'm joined by the Honourable Mayor of Mississauga, Bonnie Crombie, and Adam Marsella, Director of External Affairs at NovoNordisk Canada. Thank you so much for joining us today.
Thank you for having us.
Pleasure to be here.
Well, today is a great day for the city of Mississauga as it has signed the Urban Diabetes Declaration in Council, and Mississauga has become the first municipality to support the city's Changing Diabetes program, which is a concentrated effort to address type 2 diabetes incidence in the city. First of all, Mayor Crombie and Adam, congratulations for this initiative.
Thank you so much. I'm very proud of my council for supporting this. It makes us the first and only active city, and the entire council, not just the mayor, that got behind the Urban Diabetes Declaration and joined CCD, Cities Changing Diabetes. It makes me very proud. Of course, we have a lot of community partners and stakeholders to thank as well. And the real work, hard work begins now.
Also, this is a great time to talk about diabetes as Canada marks the 100th anniversary of the discovery of insulin, which revolutionized the treatment of diabetes.
Yeah, absolutely. I think it's a historic year, certainly 2021 being the 100th anniversary of the discovery of insulin in Canada, arguably the most important Canadian innovation. And to mark that with Mississauga and Mayor Crombie's leadership in signing on to Cities Changing Diabetes, I think is incredibly important as we look forward to the next 100 years and hopefully curbing the incidence rates of diabetes in Mississauga and frankly around the world.
So let's talk about the Cities Changing Diabetes program. What is this and why this is important, especially for the residents of Mississauga?
Well, why don't I kick that off, Adam, and then I'm sure you can supplement. But certainly what we are seeing here is that the province of Ontario has the highest rates of type 2 diabetes in all of Canada. And in Peel region, and in Mississauga specifically, our rates are 40% higher than that. So when we analyze what those factors are, why diabetes rates are so high here, there are certainly a number of reasons. And of course, we know that racialized and marginalized communities and groups are at higher risk of type 2 diabetes. So that is something that we are going to better understand and create solutions around using our new network over at CCD. But we also know that the factors that contribute are being overweight or obese, the demographics of our community. In particular, there are certain groups that are at higher risk, and we have to acknowledge South Asian community, Arab community, Black community, Hispanic, and the Indigenous communities certainly are groups that are a higher risk of getting type 2 diabetes. But there are also environmental factors in Mississauga. Once a bedroom community, once a city built around a car, wide boulevards, big streets, our car dependency has really led to fewer people being active and getting out and getting exercise and walking. That car dependency has really one of those key factors of diabetes as well, including the sedentary lifestyle. So our goal has been to build more complete communities, places where people can live, work, recreation, exercise, and a livable, walkable city, a city where people can get outside and walk. And of course, with a big focus on active transportation, which includes multi-use trails and increased building of cycling paths and bike routes, etc.
I think it's important to just even give some of the context around the fact that Mississauga is the 40th city to join this network. So this program kicked off in 2014 with, I think, 4 or 5 cities. It's now grown to Mississauga being the 40th. And so I think there's a huge well of innovation there that Mississauga can tap into. Our Canadian headquarters is in Mississauga, so we're tremendously proud to bring this here. But it's about a lot of the things that Mayor Crombie just alluded to, connecting cities to resources, bringing community stakeholders together, stakeholders who wouldn't normally have these types of conversations around chronic disease, to try and come up with better solutions. Mayor Crombie alluded to some of those solutions that we've seen in 39 of the other cities, but there's also going to be very specific things around Mississauga. We know that we're one of the most diverse cities in the world, arguably. So with that kind of background, there are social determinants of health. There are other things that we need to tackle. So a big part of this goes far beyond the mayor's office and NovoNordisk, and really talks to our outstanding community partners, and their involvement in this is going to be critical.
Adam, you spoke to us this summer about cities changing diabetes program, and you mentioned that Mississauga is also taking the lead with its novel food and beverage policies, its cycling network, and much more. Can you talk more about it?
Yeah, I think those are great examples, and they're examples that if they're, the idea of health being built into every policy, so health as a part of urban planning, health as a part of community engagement, health as a part of economic development, like these are the types of conversations where, because we know that, and Mayor Crombie alluded to the trajectory of diabetes in Ontario, in Mississauga, and this is a global issue, right? There's not an urban center in the world where we see the diabetes rates moving in a positive direction. The global trend is not great. So how do we start to bend the curve on that? And how do we do it in a way that actually resonates with people in communities where they're getting a better either standard of living, feeling more connected? We know there's other issues around social isolation as one example, time poverty. Like these are some of the themes that we're seeing in some of the other cities, and how do we apply that and contextualize that in Mississauga?
And the Canadian Parliament passed this law C-327 in mid-June this year to establish a national framework for diabetes in the country that will improve prevention, management, and research into diabetes. And today, the announcement for Urban Diabetes Declaration has come out. So, what is included in this announcement, Mayor Crombie, if you can enlighten us?
I'm not as familiar with the government legislation federally. Maybe Adam is.
Yep. So that's a great point, Pragya. Like Bill 237 is basically the requirement to establish a national diabetes framework across the country. But at the end of the day, it will come down to public health and cities and provinces to implement that. So that might be a national standard that will get set up between now and June of 2022. But ultimately, it comes down to communities themselves, local health authorities, local community members, and provinces to actually implement whatever that's going to look like on the ground. And that's a big part of what Cities Changing Diabetes helps to address.
We may want to give a shout out to one of our local Peel MPs, MP Sonia Sidhu, that I know was, had a leadership role in the development of this framework. So I want to thank Sonia Sidhu for the great work she's doing in Ottawa with respect to diabetes, because I know that was her background before entering Parliament.
So the statistics say that estimated 11.5 million Canadians are living with diabetes or pre-diabetic conditions right now. And if I'm not wrong, this is the first for Canada to participate in such an initiative. Am I right?
There was City of Vancouver had participated in the past, so they're not actively engaged, and it was the mayor, not the entire council, that got behind it. So, we are very hopeful that other Canadian cities will now follow our lead and join on as full councils. And we may also want to thank and acknowledge that NovoNordisk made a significant contribution investment into University of Toronto Mississauga campus to build the NovoNordisk Network for Healthy Populations, which will go a long way to addressing numerous global diseases and help reduce them, type 2 diabetes being one of them. So it will also bring public health experts together for study and to collect data, etc. So we're very excited about that. But at the local level, there are many initiatives that cities, municipalities can take. We talked about a few of them. One of the first ones we did was eliminate unhealthy choices in our vending machines. So carbonated drinks and the kinds of foods that we had available at one point in our cafeterias, creating that cycling master plan so that we can be sure that more bike routes are being built into our city, as well as multi-use trails. The emphasis on fitness throughout all our trails and fitness at our community centers, even through our economic development strategy, ensuring that we're bringing in investment into our city that will lead to better fit choices. Healthy by design. So by that, we mean environmental design, and that's architectural framework so that cities are more walkable, using that grid pattern so that makes the city smaller, reducing the size of our streets, etc. So community gardens, urban agriculture, these are all things that will lead to healthier lifestyles and more choice with respect to healthier health and well-being, shall we call it.
And talking about the investment, I read that NovoNordisk and the Mississauga campus of the University of Toronto have invested about $40 million to set up the NovoNordisk Network for healthy population at the UTM campus. Adam, can you tell us more about it?
Yeah, I sure can, and that's intended as a global center of excellence in public health research. So often what we find is that because there's no silver bullet in how you tackle applied research to actually have an impact on people's lives, translating that stuff that happens in the research space into actual communities where it can be helpful. That's really the focus of the network, and we're very pleased to support that along with our partners at the University of Toronto. That will become a global center of excellence in public health research in diabetes and applied diabetes interventions that hopefully does a lot of good for millions of people around the world is the intention. So we're not doing that in other cities. We're not doing that in other countries. That is a one of a kind thing as part of our commemoration of the 100th anniversary of insulin. But to make sure that that 100th anniversary isn't just a history project looking in the rearview mirror, we also want to talk about, okay, let's get a little bit more serious about disease prevention. So we're tremendously proud of that and our work with Mayor Crombie and her team as well on CCD Mississauga, because we think those two things will complement each other quite nicely.
So, Mayor Crombie, as you mentioned, the impact of type 2 diabetes in Mississauga is significantly higher than the provincial average. And 1 in 6 adults living in Peel region from ages 45 to 64 has type 2 diabetes, rising to 1 in 3 after the age of 65. So, my question is, how Mississauga will benefit from joining the city's Changing Diabetes program?
Yeah, that's an excellent question. And it certainly gives us a vast network of resources through the information hub. And we can learn by all the best practices that have been implemented in our partner cities, those other 40 cities that are already part of CCD. You know, we've already been speaking about today at our roundtable discussion, this faith network in Houston and how they targeted their members and the message that they gave. So it gives us this bank of knowledge, really, a network of community that are like-minded, that really want to solve this issue and work together in doing so. So we'll learn about all the best practices that has worked in other cities and the other global cities. But of course, Mississauga is different, and we'll identify how we are different and what possible solutions could help us bend that curve and reduce the incidence of diabetes and type 2 diabetes specifically in Mississauga based on the characteristics that I outlined earlier of our city.
And what will be the expected impact on Mississauga after joining this program?
Well, certainly we'd like to see over the long term to reduce these rates, to bend that curve, and to see that, when we have 40% higher incidence of diabetes than even the provincial average, this is quite stark and quite alarming. So I think it's very important that this work begin, and we work with our community partners and our stakeholders to ensure that something is done and that we bring in some of these best practices to really change that trajectory.
The thing I would add to that is the fact that, we've talked a lot about COVID. We've all lived through a pandemic now, which is really, a pandemic in the case of COVID that happened in fast forward. I just heard it described recently as diabetes is a pandemic in slow motion. This could take 10, 15 years to start to bend that incidence curve on diabetes rates. But we have to do it now because it threatens sustainability of health systems in Mississauga and frankly around the world. And that's really the intent here, to play the long game and to really engage with those community partners that are critical here. We've seen this, Mayor Crombie mentioned the faith-based communities in Houston. There's dozens of other examples that we've seen. Which of those examples we want to prioritize in Mississauga, that's up to the other partners to decide, what is fit and best for Mississauga for our interests here. Yeah.
Well, thank you, Mayor Crombie and Adam, for taking out your valuable time and talking to us. I'm sure other urban centers will now take lead from the city of Mississauga and will join this initiative. Thanks again.
Thanks very much for having us.
Thank you.
Thank you.